Welcome back at 8:15 now. The common cold clears up in about a week, but sometimes a cough can linger around a lot longer, sometimes even weeks. Doctors say it's common, but sometimes you may want to visit your healthcare professional for some treatment. Joining us with some tips to treat a lingering cough is Dr. Reena Mehta with Uptown Allergy and Asthma. How you doing? Good to see you.
Good morning. Good to see you too.
Yeah, so this is something that I think all of us have experienced. Like you get that sickness and you feel ill, but then you kind of start to feel better, right? But you still have that cough.
That
What's the deal with
lingering
it?
cough that can last for a long time. It's actually very common. So a recent study came out in the Canadian Medical Association Journal that stated that 11 to 25% of people, after they get a common cold, such as COVID, such as flu, can have that lingering cough that usually can last somewhere from 3 to 8 weeks.
Well, why does that last so long? Is there something that, are you still technically sick then? Or?
So you're not technically sick then, you're not contagious anymore, but what happens is from the virus, you get inflammation. So you get inflammation in your nose, in your throat, and in your airways. So if you think about it, if you're inflamed, you're swollen. Well, if you're swollen, there's less room to move that mucus. So what happens is the mucus gets stuck. The mucus gets stuck in the throat, the mucus gets stuck in the airway, and then you're trying to cough it out to clear it, and that can take a long time for that inflammation to heal.
Right, so then you're there in public and you're like, oh, it's just a tickle in my throat, and I don't want everyone around me to think I'm just like coughing everywhere because I was sick maybe a couple of weeks ago, but now I'm not contagious. How do you deal with that?
Yeah,
Right?
certainly.
Like,
since the pandemic, we're all a little bit heightened. If somebody comes near us with a cough, you're like, oh gosh, stay away. But usually these types of coughs don't require medical attention. They usually go away on their own, but they can be annoying. And so things that you can do to help are basically over-the-counter remedies. So you can do things like lozenges. Nasal sprays like Flonase can be really helpful. Over-the-counter medications like Mucinex and Sudafed can help. And then, of course, there are some warning signs about when to seek medical attention if the cough is a bit unusual. So if the cough lasts more than 8 weeks, if it's a wet cough, if you're having fever, shortness of breath, wheezing, difficulty breathing, those are all reasons to seek medical attention because then you may need a chest x-ray, you may need antibiotics. But generally speaking, the majority of these coughs are mild, benign, and they go away with time.
Yeah, and at least the way I understand from you explaining it, they're mucus driven, right? So those
Yes.
over-the-counter remedies are things that are going to help kind of clear that out.
Yeah, help it dry it up, clear it up, and then hopefully it goes away with time. But don't be alarmed if your cough lasts like 6 weeks
Right.
because that can be very common and normal.
Right, it's normal, it's not contagious. Still don't cough on anyone, right? Wash your
Cover the
hands.
cough.
Do all the things that we've been telling you to do for a while now. And then if you just want to fully try to prevent, a sickness or whatnot, obviously there are vaccines that you can get to lessen the illness at least.
Absolutely. As we all know, we have our COVID vaccines. We have boosters now. We have our flu vaccine. We have the RSV vaccine for our pregnant women and our elderly. We have pneumonia vaccines for our elderly. So obviously thinking about preventative care is always the best. If you can prevent getting sick, then you don't have to have that lingering cough. But this time of year, especially if you have little ones in daycare and things like that, it's going to happen. So don't be alarmed if you are sick. Usually the illness part is about a week, but after that, that cough can linger.
All right, that's some good tips. Really clears it up. I think a lot of people kind of question that, like, what's going on? So, all right, thank you so much.
Thank you so much for having me.